There we go.
We are Apaches, angry pensioners against cuts in the health service. We are very worried about what the white paper on health is going to mean to the health service. We think it's going to mean that it's going to be more privatisation and not be the health service as we know it.
There is no mandate for these changes in the National Health Service, and we have to ask ourselves the question, why are they making these changes? And when you look at it, there's only one reason to make these changes, that is to bring more private enterprise and more profit into the health service.
The whole thing's ideologically driven. It isn't driven about concern for us. That's why we're angry and that's why we're frightened.
Ever since I've been a small child, we've had a National Health Service. But 2 years before I was born, my uncle died. He was a very fit, healthy young man. He was into sport and he didn't smoke and he didn't drink. And then he developed a cough. And in those days, people didn't go to the doctor because it was too expensive. And then, my Uncle Ivor went to the doctor. He was diagnosed with TB and he died. That's not what I want to see. It's not what's happened since I've been a child. But we know it's what happens in the United States of America, where 50 million people don't have health insurance and have no health cover at all. We want the National Health Service as it is at the moment.
Absolutely.
We fought for it and we want it to remain.
The health service, as it is today, is entirely different to what it was when we started in 1940-odds. It was, oh, for God's sake, I've gone off with you, sorry about that.
Keep them going.
Keep going, yeah.
Say something.
No, I mean, I can remember when I was a small child, people couldn't go to the doctor because it was too expensive, and now, but from 1948, we've had a proper health service, and now private companies are already taking over parts of the health service, including a company that wants to take over the blood pathology service at King's, Guy's and St Thomas's. They've already taken it over without any consultation with us. We haven't said we want that taken over. It was working perfectly all right before they took it over, and now it's run by this big private company which has been formed by other companies that don't want us to know who they are. And so the people working for that are no longer working for the National Health Service, and it's in the hospitals.
The main change that's going to take place is at present the government gives local primary care trusts the money to run the local health service. That money in future is going to be given to the GPs. The GPs are there and doing a very good job in treating people and seeing they get looked after. They have no expertise and no way of running the financial system. It means that they're going to have to employ a company, and that company could be an American company, but whatever happens, it's going to be a company making profit out of health.
And previous privatisations have shown what rubbish it is. Look at when the cleaners in hospitals were privatised. The cleaning is not done properly now, and you're in danger of picking up an infection on top of whatever it is you're in for treatment. I mean, it's disgraceful.
And it's also the case that at one time, cleaners who were directly employed by hospitals got a decent standard of pay. Now they're being employed on slave labour rates, and this is what is going to come in. The more we get agency staff in, the lower the rates of pay are. One thing that this health bill is going to do is it's going to get away nationally agreed conditions of service for all grades of workers in the health service. So people who expected that they would get a decent rate of pay and a decent pension will now find that that's not the situation. It will be down to the individual GP consortia and the health services behind them. This is not what we want. We want a national health service which is the same throughout the country. We don't want something which is based on your postcode, whether you get a good service or not a good service. We would like to see GPs properly remunerated, but also nurses and all sorts of ancillary staff in hospital. We want proper national conditions of service. We want a national health service.
I do believe that the private enterprise has got a part to play, a constructive part in the National Health Service. The thing is that all the work has to be supervised. It has to be properly supervised so we get the best. And we don't want to follow what they've done in America. We want a British National Health Service supplied by Britain. We've got the best doctors and surgeons in the world, and we want it just to stay British.
The only way to guarantee that the health service is run properly is to have patients involved on all the committees at every level to make sure that the patients have a voice in what is being done.
It's mentioned in the white paper, but where are the details in the white paper of how we can be involved? There's nothing spelled out.
No.
We want GPs to be involved, that's true. We also want consultants to be involved. But we want people at all stages of hospital, of patient care to be involved, not just GPs. We shouldn't have a system that is just run by GPs. They have their particular expertise, but there are other groups of people within the health service who need to be involved as well. And certainly patients are going to be a large part of that.
They're not trained in management skills. Universities run special management courses, and that's nothing to do with medicine. It's a separate skill.
Yeah.
And Mike was saying about the supervision of it, but the whole point about the white paper is to remove all that supervision.
Yeah.
And they call it liberating it and freeing it and exposing choice. But what it means is taking away any accountability, especially coupled with the fact that they made no real provision for patient input.
Yes, well, I don't want to have regulation of when these companies come in and take over large parts of the health service, and consultants will come in to take over management of GP practices and these big consortiums and everything like that. They don't want to be regulated. They call it getting rid of red tape.
That's right.
Yes.
And that's why we are frightened for ourselves, and we are angry. And we're also worried for the future. We're
Yes.
all old people, and that's why we're frightened for ourselves. But what about young people? What about the future of the society? What about children who haven't been born yet? What sort of care are they going to get?
Yes.
And they're our future.
I mean, my granddaughter was born with the arteries in her heart the wrong way round and had to have open heart surgery at 4 days old. And she was treated absolutely wonderfully. But the conditions in the ward, which had already begun to have this internal market in the health service and everything like that, things being paid for and stuff, were absolutely dire, including there were 6 women who had just given birth to babies in that ward and 2 breast pumps between all of them. And that's going to get worse now,
Yes,
I think.
That's the way it's going to go, worse and worse.
Yes.
The main change that should take place is the improvement of the services. Already there are plenty of problems. Every week we read in the papers about people in hospitals, particularly elderly people, being seriously neglected. And one hospital was responsible for hundreds of people dying because of the very poor level of care. What we want to see is improvements in the health service and not a wholesale reorganisation purely to make it more profitable.
There's been a lot of talk at the moment about these changes. A lot of talk, particularly on the radio, which I listen to a great deal, and in programmes like Newsnight. And a lot of what's being said is that these change might be necessary, but this is much too fast. That's one issue about it. But the most important thing is the question of the type of change which is coming. And it's not just a question that these changes are going to take place too fast, although that is going to be an issue, because at a time of massive cuts in the health budget, we're also trying to do the most fundamental reorganisation we've had since the health service was set up. But it is the whole notion, the whole nature of the changes that are going to be made, which we are most angry about. We think it's too fast, as do most GPs, but we also think that we don't want those sort of changes, and we don't think that when people understand what's going on, they're going to want those changes.
It isn't a reform, it's a deforming it.
And another thing that has to be looked into very, very urgently, and which has been promised time and time again, is the question of mixed wards. People don't want mixed wards. Nobody wants them, and it's about time it was abolished.
And they said they were going to do that, and they haven't done it.
I'm not going to,
No,
obviously.
that's right. And the government have said, I've heard them saying over and over again, and they're not going to make cuts in the health service. They're already doing it. They are cutting all kinds of services.
And this is exactly the wrong time to make the changes when we're in the middle of a recession and all the economic problems and cuts.
Yeah.
The White Paper proposals will liberate the NHS £100 billion budget to commercial enterprises. We believe they will destroy the NHS as we know it. Healthcare should be based on public provision, not private ownership. Cooperation, not competition. Integration, not fragmentation. And public service, not private profit. 4 out of 5 doctors believe the reforms will not benefit patients. A recent report found that only 3% of Britons thought their health service needed radical restructuring, the lowest proportion of any country structured. With health professionals and the concerned public so opposed to reforms, it would be folly for the government to impose them.
If you share our concern about these changes being introduced through the White Paper, join your local campaign, defend the health service and keep it as it is, improve it, not wreck it.
Please, for all our sakes and yours as well.